Okay. What role does genital hair plan play in the gated community? I believe you understand this. What role does the genital hair play? And then, do we mess up when we remove it all? Basically, this is this part of our secondary sex characteristics, okay? Secondary, it's once we reach the puberty, and then we have now the the reproductive hormones are generally quiet during our preteen infancy up to preteen area, and then during the reproductive cycle until 49, 50, or whichever time we reach the menopause. Then after that, mostly is the estrogen, okay? Estrogen, progesterone. For the guys, it's testosterone. Though that does not mean we don't have. We actually do have testosterone. They also have estrogen, but the levels in us is different. Okay, so it's those the testosterone etc. that are the ones that cause this genital growth, and it's part of the secondary sexual characteristic. It really does not have a big issue. So removing it or not removing it is not a big deal. All we know is just remain clean on that area. Now, there are some people whose genital hair just grows too long, and then now it affects the system schooler, it affects cleanliness, then it becomes an area that bacteria can grow, especially if you're not with those kind of garments that help to keep the place dry. Because we said we need to keep that side dry. So if that is going to affect, if your hair growth is going to affect the cleanliness and the dryness of that area, then itself is going to be kind of a need as a niche ya kuongezea to keep it wet. Unanielewa? Now, the more wet you are, the worse it becomes. But really, just if you have your hygiene measures, we are good to go. Sawa sawa. So it's not that in lazima ukate ama si lazima ukate. That is purely preferential, provided the gated community is clean and dry. Sawa sawa. So do we mess it up when we remove it? No big deal. It's just part of this gated community that you keep clean and dry. Sawa sawa. All right. The other one is kindly talk about endometriosis. Is it genetical? Oh, thank you. This is a very good question, and we know some people struggle with this a lot. Endometriosis. I'll go back to my diagram. I will be the diagram. Sindio? So basically, this part of the diagram, remember we said this is the uterus. You remember that part? Yes. This is the uterus. Sawa sawa. Now this uterus has 3 layers. How many? 3. Now the inside layer kabisa, okay, you know sometimes we say hard things just to confuse you, but it's just layer. Ni kuonesha tu tukisoma kidogo, lakini means that it's 3 layers. The outside layer is like a layer like this dress, okay? It's a covering. It's a small covering, you know? Ni kama kabed cover. That's the outside layer, all right? Do not use X-ray eyes on me, but the middle layer is the muscle layer. So the name is Asa, the middle layer is the muscle layer. Remember when I said the uterus usually likes removing things all the time? Kazi when you want to find is actually the muscle layer, all right? When that layer contracts, it contracts, it gets things removed. Sawa sawa. So if you have a baby, that thing that causes labor pain is actually the muscle layer contracting. Sawa sawa. Then removing it. Then now the inside layer, kabisa, the inside layer is, so okay, the outside layer we call it parametrium. Muscle layer, myometrium. No, just lines, they're big words. They're not big words. Muscle layer is myometrium. Now the inside layer, ikondani inside, enter, endometrium. This is the layer that usually bleeds. Sawa sawa. On a normal menstrual cycle, what you lose is part of the endometrium. Sawa sawa. And you lose it. So it's usually part because every time there's a basal layer that is left regenerate for the next. Ni kama umekata a plant, but umeacha roots, from which, you know those suckers that they grow, unakata lakini kuna vile, every month. So with the effect of hormones, etc., as you go through your menstrual cycle, it's the inside lining that is called the endometrium that actually does what? That comes out. Sawa. And it comes out through this side. Uko, nje. So vagina out. Alright. So now, what happens with endometriosis is you find that the inside lining, situsema ni tatu. Na ideally, in life, kila mtu akae kwa lini yake. So endometrium ikae ndani. Myometrium ibaki kwa muscle. Parametrium ibaki kama covering. Sindio? So now you find that the endometrium, or the cells of the endometrium, are outside hiyo lini yake ya ndani. You understand? So what happens is you find that the layers of the endometrium are within the muscle. Layer, okay? The layers of the endometrium are within the outside. The layers of the endometrium are within the fallopian tube. Sindio? The layers of the endometrium are within the ovaries. The layers of the endometrium for some people are within the gastrointestinal system. Okay? The gut. Madumbos. Okay? The layers of the endometrium to some people have even been found within the lungs. The layers of the endometrium to some people have even been found within the brain. So that means this endometrium, it responds to the hormones, okay? And you see it's a cycle, that's why you see it's a menstrual cycle. Now some of these hormones at the beginning when you're having your periods or your P's, they are low. Then this ovary, remember my diagram, eh? The ovary produces estrogens, those hormones. Of course, under the guidance from the brain, in a place nature, hypothalamus, pituitary, they're the ones that help. Naambia wewe, umefika wakati toa kitu, you know. So within that, the ovary produces the hormones. Then within the hormones, those are the ones that help, because there are many eggs inside here. They are usually arrested at very young stage. So it produces those hormones that make some of the eggs get recruited. They come like a marathon. Even in menstrual cycle, it's like a marathon. Many eggs are recruited, and then now the one that has a lot of hormone, a lot of fluid, the bigger one, you know, kibonge cha egg, ndio inatolewa, is the one that you ovulate. Alright? That also means that there are some eggs that ran a race, lakini zilishindwa. So we'll reach there. Hold that thought. So when you're having this menstrual cycle and you're bleeding, those cells of the endometrium that are elsewhere are also responding to that estrogen. That means you're bleeding. So the person who has these cells in the brain might convulse during menses. Sina bleeding. You understand? Ilikuwa kwa ovaries. Instead of bleeding outside, see it react. So you find these guys have a lot of pain, a lot of, you know, a lot of issues, you know. And so endometriosis is when you have this inside lining outside where it's supposed to be. So when it's everywhere else, inaitwa endometriosis. Like if it is inside the muscle itself, ilisonga juu kidogo, it's now we call it adenomyosis. So it's actually the same thing. So they bleed a lot, they're really in so much pain. And you see, since they're responding to the estrogen, then ideally the estrogen is the one that needs to be reduced. So most of the drugs that are given for these guys are drugs that kind of counter the estrogen because they are responding to that estrogen. Unanielewa? Sijui kama mnaelewa hiyo sayansi. I hope I brought it simply. You're responding, you're outside, umetoka kwa lane yako, na mali umeenda unasumbua because una respond huko. You know, you're not doing what romance do. You are doing what you do there. So you're causing a lot of pain, a lot of trouble. And some of the issues these guys have is too much bleeding, too that thing. So yeah, so they kind of have issues with conceiving because mainly this endometrium will be. There's always a reaction. Have you ever heard the word inflammation? Inflammation, eh? Nikikuja nikupige ngumi. So itafura. What will have happened? You will have inflamed. A lot of blood vessels will come there. It will be red, painful. Or if a bee sting comes and dungas you, that thing that happens is called inflammation. So if this endometrium goes huko nje, it's going to have that reaction there. Now you see where the pain is coming from. So if you're having reactions with my ovary, then it means the hormonal production of that ovary is an issue. Because kazi yake si ni kutengeneza hormones na kuamsha eggs na vitu kama hizo. Si ndio? That will be a problem. So kama unasumbua hapo, it means also those hormones are responsible for the cycle and also for reproduction inasumbua. Okay? So ideally, when it is not genetic, it is not understood why these things happen. We still do not have, there are theories that we have postulated that sometimes you have, instead of, naongea sana, nitamaliza. So, but I think I'd rather do a little na tuelewe, sindio, than just to skim through. I don't think it will be fair. Maybe another time we'll add another opportunity. So unakuta, when now it's outside, it's causing all that inflammation, it's going to affect maybe reproduction, it's going to affect the pain, and depending on where it is, it's going to be an issue. Sawa sawa. So most of the drugs that we use are the drugs that will counter that estrogen that endometrium is responding to. Sawa sawa. Now it becomes so much. Imagine if, the gated community, kuna neighbors, sindio? The intestines are there. The ovaries are there. Some of that inflammation inakuta to a point where umeshikilia fallopian tube, instead of kukaa free, imefunga. Sindio? Because the ovary is also trying to, the uterus, yani all those things are inflamed. And when you're inflamed, you heal. And sometimes you heal with scarring. Sindio? Like, so kuna scars, those scars can also be huko. So unakuta ukiingia, even if you're doing an operation for such a patient, you find that there's a lot of, my name is Ouma, lakini I know somebody here knows madhogodhanio. What is madhogodhanios? You know madhogodhanios? Is dogodhanios, It's dogodhanias to a point where kila kitu imeshikana. Then now, kama you're doing that, then it means even that egg, how does it reach the uterus? How does that sperm reach the egg to cause a fertilization? Things like that. So sometimes we find that we can even decide to harvest, if say it is for a 20-year-old whose main thing right now has no issues, does not want to conceive, then unakuta we can even decide to harvest or let them know that we are in for a long haul. Mtu asikwambie nimekutibu endometrium imeisha, ni kitu tunasumbuana tu. You get? Because as long as sometimes we do test, we do an ultrasound, tunezaona, we see things like cyst, we can do an MRI, you see those endometriotic things. Sometimes we even do some surgery. Nowadays we have something called minimal access surgery, where laparoscopy is done. It's like putting, unakata kidogo, unaeka kamera, unaona, unatoa the maximum amount that you can remove. You remove some of them, of course. Anything we usually remove, we take to the lab so that it just confirms our diagnosis. But you're in for a long haul. So it is important that someone who has this endometriosis to know that tutakurukuru. You understand what I mean? We shall struggle. It's a struggle that is overcomable, but it's also good to understand that it's a long walk. So you'll probably be on painkillers for a while. Sometimes you'll have operations, because when you have those adhesions, the madhogodhanios, we call them adhesions, because everything is kind of adhering to each other, and those adhesions sometimes trap nerves, and when you finya a nerve, you're in pain. So sometimes we release those adhesions, it makes it better. We remove the much that we can, but reality is sometimes it's really hard to remove everything. Sawa. And whatever brought it in, we said sometimes one of the theories is retrograde menstruation. So things like pelvic inflammatory disease, unakuta maybe you have a problem with the exit. So ile damu instead of unakuta sasa inasukumia juu afu inapeleka. Remember this is a tube, Remember it's a tube, vagina, cervix, uterus, fallopian tube, ovary. That's how now. Those are some of the postulations. Ndio iliendaenda huko hivyo. Sawa sawa. Okay. And then for parents with young teens, 5 years old, maybe kids, how do we start teaching them about the anatomy of the 3 holes, especially the cervical hole, mummy hole? I think it's good to understand your child, but you put it in the simplest way possible, and that means you have to understand it yourself. The only way you can share knowledge is to understand it, and then you show them, you tell them, because they understand. Whether if the guys have 2, the females have 3. Okay, so it's as much as the earliest you know your child best, sindio, you know their ability to understand, and even if they're not, you can just introduce it slowly, kidogo. You can just say, did you wipe yourself, No, like, because you cannot overwhelm a baby, a 5-year-old, with all these conversations. Surely, unataka tu mtoto akudharau bure, Hakuna haja. You need to introduce this conversation slowly by slowly. And this is where I'm going to bring the bad news. The reason why you need to introduce this information slowly by slowly is because they need to know how to protect themselves and to protect that area and to be able to tell you when things are bad there. Also to be able to tell you. Unfortunately, I meet many young ones who are violated. Unajua kuna watu wengine tu, I think ni shetani mweusi tu. You see a 5-year-old child and see your own things. You understand? And the only way you can arm your child is give them information, tidbits, kidogo, as you keep understanding them. I will not have full answers for the special children because I lack in knowledge on that area. I know sometimes as they draw, as you converse, I may not be able to fully tell you, and I'm going to be very honest. Sitawadanganya. For the special children, I may not have an answer. But for the other children who are normally growing, just introduce to them. Let them know. Even when you're washing them, let them know this is a place nobody should come. Because at the end of it, most people who are violated by persons known to them. The unfortunate thing for our lady who was in Forest Road, unit of Hauti, it's 1 in a million, or not in a million. Kenyan lazima tuokoke. But then the young ones need to know for sure, because the people we live at home are people you need to be careful with. Most of what you have found that the guys violated are violated by persons known to them. So you need to introduce this formation, and you need to be close to your child enough for them to be free to let you know what is happening. Sawa. For them to be free to let you know what is happening. I'll give a very good example. I was working somewhere in a barracks. The barracks we work usually, I am a doctor to the soldiers and their spouses and their children. Whichever it is. So I had the pleasure of helping a mother to deliver, say in a particular year in August. Sawa. So I've had the privilege to help out, tukazaa vizuri, kaenda mzuri. Then later on, after 2-3 months, ananiambia, by the way, doc, I need you to see my son. And I'm like, how old is your son? 2 years old. Like, akona rash. So you see this online thing, watu wanasema, akona rash, niandikie dawa. Usually, I know we are in the online era, and Corona has helped us enough to go beyond the physical, but it's also a trap that we need to get out from. Because now this one says that, I'll send you a picture. I'm like, so let him toto. I'm like, then you get busy as a mother, you get busy, you do your thing, you do the thing. Then another time nakutana na doctor, doctor, I was supposed to bring my child. I'm like, so mlete to me. In fact, those days that you're free, mlete leo. I said, no. Let me go to work, then I'll come back. I'm like, so I'll be there tomorrow. Forgets again after a month, and I'm later. This is a 2-year-old boy. 2, moja, mbili. 2-year-old boy who had warts in the scrotum and the anus. Now warts na hajikuni elsewhere. I'll say ama hakuna mtoto mwingine kwa hiyo gated community ya ukweli, not this one. Hakuna mtoto mwingine kwa hiyo community mwenye ako na hiyo rush kama yake. And I was thankful, Lord Jesus, thank you I did not prescribe on phone. Because you see, for a 2-year-old, to be very honest, warts was not the first thing I had thought about. And if it was warts, I was expecting it maybe kwa mkono, unajua amejikuna, But why is this warts only in the scrotum and the anus? Nisaidieni kufikiria. Hiyo unaogopa kusema ndio hiyo. Whatever it is you're refusing to say, it is that. And you see, I know this is not mother-to-child transmission because this kid is a 2-year-old. Sindio? I had the privilege to bring their last born to life. So I know it's not the mother. So it's not a mother-to-child transmission. Yeah? Of course, when they scrutinized, they found things that were not right. Okay? So yes, how do you start teaching them? Just start. You know your child best. Start slowly. Just start gently. Let them know how to keep themselves locked up on that side. Nobody to touch areas that are not wanted. You get my point. Give your child the stepwise knowledge as they do not overwhelm them. You'll overwhelm them, they will not appreciate it. Tutanza historia, madhea kuna stories. You know how they used to tell us, all our parents here used to be number 1 in school. So when they're always number 1, then they start, mimi nilifanya, like, they are starting ile story yao tena. You don't want your child to dismiss you on such issues. Sawa. Or what's your opinion about plain yogurt to relieve vaginal itches? I believe this one is drunk. Sawa. Through the entry, not the exit. Sawa. Through the what? Yeah, so sometimes they say nasaidia na normal flora, etc. I have actually had a client who used it down there. So how will you confuse? Because already when you have yeast infection, inakanga maziwa mala. Unanielewa? So ukiongeza yogurt ndani ya maziwa mala ya isaidi, unanielewa? So it is okay. It's also healthy. It's fine. But provided it's not in the exit. Sawa. Because we said mummy hole is self-cleansing. Mummy hole is self-cleansing. Sawa. Hiyo acid ni mzuri. Mungu alipoiona acid, he said it is good. Because yeye ndiye aliweka hapo. Sawa. All right. Discuss UTI, especially in children, what results to it and how can it be reduced. Now, this is what I started with. UTI, especially in children. First of all, the perineal hygiene that we are talking about, and especially for the ladies. Because you see, the guys have a longer urethra. Sindio? So the chances of contaminating issues zao is iko, but imepungua kuliko for the ladies with the gated community. So you find, and especially for the children, they are happy. Nilijipanguza, but alijipanguza aje? Alipanguzwa na the small little girl, maybe the other big sister. Sometimes tunasaidiana kwa familia. But how did they do it? All right? So basically, most of the ones I've seen in the children is actually purely perineal hygiene. Fundamentals, uko, just perineal hygiene. How you clean, how the child wipes from bele to nyuma. The reason why I said it's sterile, because even that good bacteria nilisema, ikisonga mbele, tunasonga mbele, not with that bacteria. Okay? The beauty is for children, rarely is that mummy hole working. But you remember, they also have a pupu hole. Na tulisema pupu hole ikoaje? Imebarikiwa. Sindio? Pupu hole imebarikiwa na bacteria. So, you can imagine the amount of bacteria that will come forward. Sindio? Same things. But these principles are similar. That's why I started with the anatomy. The principles are similar. So, generally speaking, every woman or every female child in their lifetime will have to have UTIs sometimes, because binguni vitu ndi perfect. In this world, it's not perfect. It's not perfect. So here, but you can reduce it by just that perennial hygiene, wipes, keep the place dry, keep it clean, keep it dry. And it's actually much easier for the children because bado hawajaanza ile hormonal system haijaamka sana. So one of the holes is kind of dormant kiasi. So zile bacilli, lactobacilli isumbui sana. So it's actually much easier for the female young child compared to us in the reproductive system. Sawa sawa. Okay. Endometriosis tulisema. I'm 46 using calendar family planning since 2016. I've been okay all through. On the first of this month, I lost 11 weeks conception, which I didn't know was there. Which calendar? I had assumed the 2 months periods miss was because of age issue. Question. Mumelewa hiyo swali? We have a 46-year-old lady. She's been using the calendar family planning. It has been okay of late. But unfortunately, early this month, we're in March. Early this month, she lost a pregnancy and she realized it was a 11 weeks pregnancy. She had expected, because she's 46, that probably in menopause, but ideally the lack of menses was actually because of a conception. Mumelewa your place, eh? So the question is, why did I possibly lose the conception? Number one. Was it a safe age to have conceived? Number two. Number three, what safety measures should I take? Haven't quite healed. All right. Now, why did I possibly lose the conception? There are many reasons for pregnancy loss. Now, that is a big topic. One of the topics is anatomy. One of the other topics is maybe you have other comorbids, diabetes, hypertension, and all that. And interestingly enough, 50% of conceptions are lost before the lady knows she's pregnant. Sawa? And I'm not talking about a 46-year-old. I'm talking about a 30-year-old, a 20-year-old, not a 10. That is not going that side. Just a normal reproductive age. Now, in the first trimester pregnancies, now pregnancy is divided into three. For the purposes of characterization and also for us to study and know what is happening here and there. Sawa sawa. So it's divided into the first 3 months, the second 3 months, the last 3 months. Trimester, first, second, third. So the first trimester pregnancy, 90% of them inakuanga genetic. An issue not about the mother, an issue not about the fetus, about the father, but an issue about the fetus itself, all right? The genetics, the DNA, something about that, okay? And 50% of these losses inafanyika just after you've missed a period. Yenye unaona, ala nimemiss, then 1 week later, imekuja mingi kidogo. Something like that. So some people actually have had miscarriages without knowing imekuwa ka miscarriage. Sawa sawa. But most people, the reason why I'm saying is this, most people usually blame themselves, and I don't know why, because it's not necessarily what you did, what someone did. It would be, but 90% of those losses are because of the genetic predisposition of hicho kiumbe ambacho imetengenezwa. Hiyo Kiswahili si rahisi kusema. But most of the time it is that. Sawa sawa. So kindly ladies, and especially unakuta watu beat yourself too much for an issue that even you could do nothing about. Interestingly enough, some of these issues are because if this particular conceptus would not have survived because of whatever chromosomal anomalies, sijui nini, later in life, so it's put in such a way that inatoka mapema. So you have some people who have issues with their cervixes. Unakuta some of them wamekewa McDonald's stitch. Tumesema, oh, that cervix is incompetent. Hiyo stitch tunaweka kufunga hii cervix. Hiyo stitch tunaekanga at from 13 weeks huko. Why? Sababu whatever we do, ile ya kutoka in the first trimester, because of whatever it is, itatoka. That's the reason why that particular stitch is timed wapi? In this early second trimester. Okay? So it is a possibility the first trimesters, please don't kill yourself, but if at all you have chronic diseases, vitu kama diabetes, hypertension, lupus, sickle cell, that sometimes unakuta mtu akona long time, those things need to have been controlled kabla ukue pregnant. So that before you get pregnant, then we do something we call preconception care counseling. So that we say vitu ziko sawa, your weight is okay. Hallelujah, watu wenye walikimbia, tunajijua wenye hatukukimbia. Wamesemekana wanashine hapa. Sasa kama unashine ukimbia. But you see, the things about weight, those things, hypertension, diabetes, chronic disease, that are not thyroid, that have not been controlled, hizo pia zitaanza kukusumbua within the first trimester. Sawa. Was it a safe age to have conceived? It is safe. It is okay. It is okay. In life we have early bloomers and late bloomers. Sindio, I don't know who said that you should have been married by 22, you have moved. No. So unaweza kuta, some people are late bloomers. Okay? It's not about your age that you lost it. It's just some of those things that sometimes, even as doctors, even fertility specialists might not do something about. All right? So, and then what safety measures should I take? I haven't quite healed. Now, this depends on whether you'd like to conceive or not. If you'd like to conceive, probably you want to conceive, give your body at least 4 months, at least, ideally 3 to 4 months, at least 4 months before you conceive again, because you need to rebuild and restock your plenishes. Come out with your folic acid. You need to do that, all right? But for those who do not want to conceive, there are many family plannings that you can do. Now, this is the point I start by. I'm looking at all of us here. And this is no offense. I'm seeing we're Africans. Kweli? Africans. Ama kuna nan African? Sijaona. An African man. African men. I don't know about their discipline. I don't know. Let's discuss. Because this is not gynecology. This is now social. What is the discipline of the African man? Tuseme tu kweli. Maybe me, I have not been blessed by a marriage yet. Maybe the boy child, bado amelala. So, Mungu atamsaidia. But help me. What is the discipline of the African man? Senior, when they want, they want. Whether I want or not. Yes, I'm saying this because I have had the pleasure of the privilege of being able to deal with couples too. And I've had those who are telling me, Doc, have you ever seen somebody calling you and is serious? And anambia, Doc, huyu ni mtu nimemfanyia CS. Nimemfanyia CS, it's the third day. Namwambia wewe leo, things are okay, baby is okay, mommy is okay, exclusively breastfeed for 6 months. Unaona hizo jibajabas tunasemanga kabla, tunawasumbua kabla mwende nyumbani, si ndio? So I'm in the process of this jibajaba. And this lady is now looking very disinterested because I've not gotten into the jibajaba of her issues. Her jibajaba was, unanipe family planning hapa kabla nitoke. Naambia, ngoja kwanza, let us heal. Akaniambia, I know where I am going. You are going to give me a family planning before you discharge me because I am going nowhere. So we had to talk. And that's why I'm asking. I'm happy for this lady. Surely, there are remnants. But those remnants are few. Tukubali tu. Sindio? Ama naongea mama pastor. Si remnants wako lakini ni wachache. Sindio? So personally, I feel for some it works. But the chances, when you're talking about family planning, I always must talk about failure rate. Sawa. Because bado hatuko binguni. Niliwaambia kama hatuko binguni, nothing is perfect. Hata hiyo BTL, we have had people who tumetoa fallopian tube. Nakumbuka? So how when we go to the theater, what we do, wakati tunafunga, I'll assume this is a string, the stitch that we use. So tunachukua hii fallopian tube, tunaikunja hivi, tunafunga hapa, mimi nafunganga. Alafu tunakata hata hiyo iko hapo. Then narudi huku, nakunja, tunafunga, and then we even cut. So that this part of the tube and this part of the tube do not meet. Trust me. Hii mwili si yetu. Kuna mwenyewe. Kweli? 1 in 200 still fail. Na hiyo part iko kwa lab. Niambie science gani hiyo? Niambie ile iko kwa lab. Ukienda iletwe hii eti ilitoka lab. Hebu leta results. It has confirmed that the fallopian tube element. Na mama amekuja karibu hata niachie mtoto aseme si wewe. How now? It's because this world is not perfect. So when I'm talking about failure rate, I will talk about fertility and this family planning. I will talk about failure rate because I believe tukifika nyumbani ndio tutafika 100%. Hii hata ya BTL tunaita 99.9 because kuna vitu tu zinafanyanga tu hivyo zinatokezea. Then hata okay? Now failure rate of calendar. Hii failure rate ya calendar kwa kusema kweli ni nyingi kuliko ya tube. Hapo ndio nilikuwa nikifika. Si ndio? It is actually much more because I'm putting hatutasema the African man hata sisi tuko na joto kweli? So this failure rate I will not talk about it. But nonetheless, there are several ways in which we can do this family planning. And usually you go with your health service provider and we check, okay? So we usually have indications and contraindications. Sawa. So some of these indications, some of these things kuna permanent, long term, na short term. So wacha nianze na permanent sababu nilishaanza nayo. Tunaweza funga hii tube ya mama. Si ndio? Nafunga right, nafunga left, napeleka lab, nakwambia you are 99% safe, and then I pray that the Lord keeps it safe. Because 1 in 200, nyinyi najua nyinyi watu ni wa Google hapa, mutaenda ku Google, mutapata still there is a failure rate. Sawa. But it is very successful. Because then you find that some young ladies, maybe I got married and then I got maybe a baby or two, then I found this is done, nifunge, sindio? And then now you find that something happens, life does happen, then maybe to a channel, then I get married again, then this other guy wants a baby with me. So tell me how you are going to reverse a 99.9% success rate. Because now there are those who come sema kimi nilifunga tafadhali fungua. Na tulisema ni 99. Si ndio? Tulisema ni 99. So unaona mnatuchanganya. Because we funga, and that's why you'll see if you're less than 35, uende kwa daktari yako umwambie daktari please funga this thing. I'm telling you shall have a conversation from here to Timbuktu. Because utakwambia, are you sure? Are you 100% sure? Are you sure? Do you know the other methods? You know, because of that 99. And your success rate ya kufungua 99 is less than 20%. Personally, I don't do it. Hata sijui sijawahi kuwa na success, so I just tell you, mimi sifunguangi. Wewe ende ujaribu watu wenye wanafungua, funguanga. Sawa? Yes. So that is one of the permanent. And even the men can have it. Where we have the vas deferens inafanywa, nipped. Okay? It's like their tube. That's also the same thing. The African man again, sasa mimi sitaingia hiyo sababu ni social. Sometimes when I'm talking about fertility issues and I tell the umepima mama, and you're like, Mommy, you're okay. Your hormones are okay. Nimeangalia hii tube. You know, it's like a tap. Tap can have, it looks beautiful, but maji haipiti. So we look through the tubes. We do a HSG, able to see ile njia imepita, imeenda, imemwaga, something like that. It is okay. Tumeangalia hormones ziko sawa. Naambia, mami si ulete nani, because it takes two. You cannot conceive yourself, can you? You cannot. It takes two. And I know when I tell you that, it will take 6 months kabla huyo mtu akuje. So I always tell them, by the way, what I'm going to tell you is hard. Bring your guy, we talk. And then anasema, kwanza, once with the military, first of all, the first atasema, niko Somali. No, that's the next year sasa. Sindio, na si ni ukweli. Alafu sasa akuje uanze kumwambia, sijui, anyway. So now, the men can also funga. Sawa. The other long terms, we have two. We have the ones that is put inside through the vagina, to the cervix, to the uterus, IUCD. There are several types. There is copper IUD. Then there's one that has a particular small hormone called progesterone. The most common of this is called Mirena. I'm sure some of you have heard about Mirena. This is a .com people I know. So now, this copper T, it can do up to 10 years. It can do up to 10 years. But ukitoa, then you can conceive. It has that copper. Unaona copper T. Those two copper ions. Is a copper T. Ako ka copper. Ndio kanekwa hapo ndani, ndio inafanya hiyo kazi ya contraception. All right? So it can do up to 10 years. IUCD pia, hiyo Mirena, it is impregnated with that hormone inaitangwa progesterone. Hiyo pia ni mzuri, but it stays 5 years. And we also use it for also non-contraceptive benefits. Because that progesterone pia inasaidia reduce the amount of bleeding. Okay? So unaweza pata somebody who is bleeding too much, niambia wewe weka hiyo. Not because I want you to contraceive, but I just want as part of a prescription. Okay? Long term. Alafu kuna hii yenye inawekwa kwa mkono. Most of the time for the right-handed, we put it on the left because you're not using that much. For the left-handed people, we put it on the right. Na ni mali inafichika tu, just somewhere. No, on this side. Yes, implant. Now, for that, it usually has a hormone within it that is being released pole. It can do up to 3 years, okay? Inatolewa tu pole. The only issue with it and the side effect profile is you kind of bleed irregularly. Sawa. So, it's good to know. Because everything in this world, tumesema kila kitu iko na side effect. Hata saizi nikiwape ugali, what is the side effect? Mutalala. Kweli? It is the side effect because nothing here is perfect. Sindio? So hata hiyo iko na side effect. Usually you find they bleed a bit irregularly. For somebody who is okay with it, is fine. All right? But somebody who is not okay with bleeding, say for instance, a teacher will say, no, I'm teaching teenagers. I cannot have myself bleeding accidentally. Unaona? So they'll decide. So it's also good to know the side effect profile of what goes with it. Of course, this one we cannot use for somebody who has hypertension, somebody who has clotting issues, So we check you and we have this discussion, we see, because what is good for me may not be good for mom, may be good for her, and, something like that. Or what I prefer is different from what you prefer, and so on, so on. So that is also similar to the one, there's that 3-monthly jab. See, DMPA. DMPA, it's a particular hormone, similar. So that one is put every 3 months. Every 3 months, unaenda, tunaangalia pregnancy. And by the way, still remember, baseline failure rate, sababu hatuko binguni, sindio? So that musilete watoto kwa geti yangu sababu ilifail. Mimi bado sijapata, bado I'm looking forward. So, your failure rate musisahau. But also that one, we usually have irregular menses or irregular. So some people, you'll find that they bleed a lot. I have a friend of mine who, she never bled for like 9 months. So unajua, the body is different. So I'm like, hey, you're lucky, my friend. Pads is off your rota, which is fair. Anyway, so that's different. Then, so those tumetoka long-term, tumefika long-term use. Tumetoka permanent, tumefika long-term, this ka intermediate. So by the way, if I've used this shindano or this for maybe 10 years or 5 years, the reversibility rate, mwenye ameitumia for 10 years, probably will reverse a little bit more slowly than the person who's had just 1 or 2 jabs. Sindio? Because for sure, ni maumbile tu. Sawa. And then now we also have the pills, okay? The pills is also home. And by the way, thank you for the baby. Mwambie, hallelujah. There are 2 types of pills, for the breastfeeding one and the non-breastfeeding one. They are different, okay? So the one for breastfeeding one, kuna particular kahormone yenye hatupei kwa sababu it interferes with milk production. Sawa sawa. So ni vizuri kujua that is home ni tofauti. So these pills you take them every day. Ukisahau utashikwa. Sawa sawa. Ukisahau utashikwa. That means the reversibility rate of this pill is much faster than the other one. Sawa sawa. Now, this particular one that our teens love a lot, especially our college students, and I really am here to disadvocate. Is there anything like that? Disadvocate. So if you know you're sexually active, let's just choose one. Sindio? Hawezi hatumia morning after pill, leo, kesho kutwa, because it is emergency. Kwani emergency yako inakaaje? Unanielewa? Yeah, because that emergency pill has, unaona this pill. Now, these pills that we take, they are those ones for 28 days and they are those ones for 21 days. Now, the ones for 28, ideally, they are actually for 21 days, all of them, okay? Lakini unakuta mtu, ukimwambia wacha kwanza for 7 days, alafu ndio uanze, anachanganyikiwa, si ndio? So akichanganyikiwa tena anaanza, then anakuwa confused. Humanity, perfect humanity. So what we do, ukiona umepewa ile 28 days, you'll notice the 21 days look similar, then those to 7 are different. Hizo ni multivits. Hakuna hormone ndani yake. Okay? Ni vizuri ujue. Yes, because the hormone actually works until 21 days. You guys, I'm sure you can go and buy and see. It'll be a bit different. And so you don't take the Wednesday one on Tuesday, you don't take the Thursday one on Wednesday, you know. So use the one for that day. So now this e-pill that I'm disadvocating, why am I not confident using that word? Is it real? This pill has all these hormones put together. Hiyo ni hormone gani unatumia? Ni mingi. Okay? Ni mingi. So it can only be used at least once in 3 to 4 months, because its concentration is so high. If you're sexually active, especially for our teens, then usitumie, you just decide. Sawa. Now the reversibility rate of the pills is so high, so really discipline. Now I'm a doctor. Oh, daktari, kuja call, kuna mama, mtu kama mimi siwezi tumia pill sababu nitasahau. So you understand what I mean? I will forget. So different persons also have different preferences. So unajijua. For the ones who have used it successfully, some of them tell me, naikanga hapo, oh, you don't forget, I put where I brush my teeth, because I know I will brush my teeth every day, therefore I'll remember. Or my spouse will remind me, me don't want history ya kukumbuka, let me just use it, maybe an IUD, you know? So there are several. And by the way, just before Corona, there's one we were trying when I was still in Kenyatta. It is for the gentlemen. There's a particular hormone called testosterone that we were trying. It was in trials. I don't know, it's long since I read about it, where it's like a gel, ni kama mafuta, they were supposed to apply over here. Then when you do a seminalysis, if it is less than 2 million, we know it's a sterile effect, less than 2 million. Lakini Corona stopped reggae, so hiyo ni kama tulisahau. But personally, I really think we need to find one for men, because let me leave my personal opinions. Let me go back to medicine. So here, what safety measures should I take? I've said yes. Try to avoid conception. Those are the things, but you need to discuss it with your relevant, because every has its own different contraindications. For instance, if somebody has had an abortion, a miscarriage, afu amekuwa infected, maybe, and you're still treating the infection, I'm not going to put IUCD on you, even if it is the one that you prefer. Why? Because the IUCD will be a nidus for infection. So different people will prefer differently, but your preference may be different from what you need. So you can discuss that. Doching. What is doching? Doching ni kuosha mama hole. Simple. Doching ni kuosha nini? Mama hole. Sawa. wengine wanaingisha vidole, wengine wanaweka pearls, wengine wanaweka blanketi, wengine wanaweka yogurt, wengine wanaosha sijui nini. Douching is interfering by so-called cleansing that mama hole. To be very honest, the studies that have been done about it, they have not been good. Leave the mama hole to be self-cleansing. Sawa sawa. That is what is douching. Nilisema naongeanga raka, keep me in check. Naongeanga sana. Okay. Is question 1, is giving birth cause her reduce the age of doing sex of a woman? I think I'll need to be helped on that. Kidogo tu sababu sijaelewa. At what age do a woman grow the pubic hair under there? Because my daughter has grown those hairs and she's 8 years. And is it normal? Okay. I will start with number 2 because I understand number 2 more than number 1. I'll think about this number 1 before. Now, there is no particular age that we say. Sawa sawa. But generally, at teenage 12 etc., we are okay because now you have the secondary sexual characteristics. Now, for a woman or a female child, unakuta, the voice also changes a bit. The breasts start having the mound. Kamulima ka hivi, you know, the hair also grows. Now, usually, it is also dependent also on the body fat, okay? The weight and the body fat. So, that means that a bit of a heavily built child who is amebarikiwa kiasi will probably have secondary sexual characteristics a bit earlier than mwenye amekonda kidogo. Okay? So that's how come inaweza kafika ata 8 years old. Sawa sawa. And so by the time anaanza to grow these hairs, it's also good to know that you're the type who needs to have ile conversation. Remember the first question? How do I start having that conversation? Ukianza kuona hizi, conversation should have started by now. Slowly, according to the child's age. And let me tell you, toys these days, they grow fast. We unaona 8 years old, maybe early grew kitambo. Something happened, some of us ilitupita. But yes, they grow a bit. So I will not talk about the age kid, but when you look at the West struggle with obesity more than, we are coming back with it, but the West struggle with obesity more than we do. Sawa sawa, generally speaking. So you'll find that their children kind of have a bit of an earlier one, but the children, the one I mean, is the one who is a bit weightier than the other one. Sawa sawa. So it is normal, lakini ni sparse. It is not fully grown, but it is normal because now it means those hormones zimeanza kufanya kazi. Ovary imeanza kutengeneza estrogen, inaanza kutengeneza testosterone. We said we also have testosterone. Sindio? Testosterone is the most predominant male hormone for the reproductive one. The estrogen is most predominant for the female ones. So even for the females who kind of have conditions like PCOS, polycystic, things like that, unakuta unatengeneza more normal testosterone but less estrogen. So inakuwa relatively more. So unakuta pia akona manywele. Sometimes unapata some ladies have a bit of kidogo too. And then you see the women have a bikini line kind of pubic hair. Eh? Bikini means an inverted triangle. The men kind of have a diamond shape so that it comes to the kito of umbilicus, goes that way. Then, you know, ni kama wako na bikini times 2. So unakuta one is inverted, the other one is non-inverted. That's how I remember anyway. So unakuta now some ladies who have a bit of more testosterone or less relatively, so pia wanaweza kuwa nayo. But normal hair is okay, it happens, and this is a lady who probably will start having menses soon. So the conversation should be done. Bado nafikiria hii swali, so naiweka hapa. Does removal of the uterus control reproductive cancer, cervical cancer? Now, this cervical cancer, unakumbuka, in my diagram, iko wapi? Kuna hiyo. No, a reproductive cancer, it can be anything. It can be ovarian cancer, fallopian tube, the uterus, the cervix, the vagina, etc. All right? Removal of this cervical cancer. Now, cervical cancer is usually caused by this thing inaitangwa HPV. It's a particular virus, and apparently it's the only sexually transmitted virus that I know of yet. I'm yet to go read about it. And nowadays, there are so many other types of sex. So we are seeing these people who have HPV, that so oral pharyngeal kind of cancer zimeongezeka because there are many ways of many. Let me go back to cervical cancer. Kuna HPV, there are several HPVs. Kuna 6 types, 6, 11, 18, 35. But the most common one, yenye inasumbuanga the cervical cancer, yenye inaleta hiyo ni HPV 16 and 18. Na kuna zingine za 33. There are several kinds of cancers, like HPV types. Now, a woman who is sexual and in the reproductive age at some point will have had HPV. But because of immunity, I told you the grand designer is a real designer. Because I'm made to design with a body that has its own immunity, then you find that people deal with this HPV, okay? Unakuta tu in the next 3 years in its natural history, there's a HPV, yani the body just has a way of dealing with it. But then now you find that those where that is like almost 70 to 80%. But kuna some of these cervical changes that this HPV does, like for some people, they are not able to deal with it, so inakuwa prolonged. So you start having changes in the cervix. The cervix, if I was to divide it into 3, lower third, mid third, half third, like into 3 equal parts. So unakuta, tukifanya pap smear ama some test, unakuta HPV, the changes it's doing may increase from lower third, imesonga, then now it becomes cervical cancer stage 1. Okay? Cervical cancer stage 1 is the one that just affects the cervix itself. Of course, there's the type that you can not see by your visual eyes, but are seen by the microscope. So kuna ingine tunasema ni microscopic sababu ni microscope ndio inaona, kuna ingine macroscopic sababu ni macho ndio inaona. Kuna maneno mingi ni kusumbua tu akili, kutusumbua ndio tuanguke mtihani, but it's okay. So unakuta removal of the uterus, it depends on what stage. Because if this cervical cancer is just within the cervix, then removal of the uterus and the cervix inaweza isaidia. But sometimes it moves. If you remember my diagram, so I told you this thing is within a system, sindio? And now kuna pelvic, like other pelvic structures, bladder, rectum, kidneys, ziko hapa. So kama imesonga to other areas outside these genitals, removal of the uterus itself will not sort it much. Sababu imesha songa. Sawa sawa.